The media landscape in Ghana is in a sober mood following the sudden demise of Komla Dumo. Though the official cause of death is yet to be announced, media reports attribute the sad loss to a cardiac arrest. As many in the Inky fraternity would attest, being a journalist is quite a high-pressure job, and Komla Dumo himself admitted taking his body to extreme to make sure the story was done in the right way. And Komla's death has raised questions on the risk of heart attack, many commenting on social remarks on how fit and healthy they look. Young people today on the other side. Our guest today is Dr. Abdul Samid Tanko. He's the head of cardiology, National Cardiothoracic Center in Kolebu. You're welcome, sir.
Thank you.
Now, I have this the definition for cardiac acid, and then it says the cessation of normal circulation of blood due to failure of the heart to continue to work effectively. These are quite, professional terms and medical terms. In the layman term, what is it? Cardiac arrest.
Cardiac arrest. Sudden cardiac arrest refers to a condition where the heart suddenly and unexpectedly stops beating and depriving the supply of blood to the vital organs of the body, including the brain, the kidneys, and all the vital organs. So in a nutshell, it's just sudden and unexpected. It's quite important to add these two important words. That is sudden and it happens unexpectedly. The heart stops beating.
Is it the same as heart attack? What's the difference between cardiac arrest and heart attack?
Heart attack happens when there's blockage of supply of blood to the heart, to the part of the heart, and for that matter, it doesn't allow the heart to pump properly. But the heart doesn't stop during heart attack. Okay.
So cardiac arrest, the heart stops.
Heart stops suddenly and unexpectedly. Heart attack, there's a reduction of blood flow or blockage of blood flow to a part of the heart that leads the heart to the muscles of that area to begin to die slowly. But it doesn't lead to, the heart doesn't stop immediately. The heart will continue to work. However, certain heart attacks can lead to sudden stoppage of beating of the heart. So one can lead to the other. That is, heart attack can lead to sudden cardiac arrests.
So cardiac arrest doesn't really affect, maybe as an individual, it will happen to me all the time. I feel my heart stops.
No, cardiac arrest happens immediately, and if attention is not given immediately, it leads to sudden cardiac death. So
and on the other hand, heart attack?
Heart attack can happen, cardiac arrest can happen during or in recovery from heart attack. For example, if you suddenly felt a heart attack, your heart will not stop, it may not stop immediately. So you will not have an arrest. But when it's going on and it's a massive heart attack, I will show you some pictures. Now, if it's a heart attack, you see this, let me take this pen to make it clear. You see these vessels of the heart. They supply blood to the heart for the heart to be able to pump and beat properly. Now, when these vessels, there are three major ones within the heart. If one of them is blocked, the area that vessel supplies blood to the heart will be affected, like this darkened area you see. This area, for example, this vessel probably has been blocked, that leads to this heart attack to happen. You see the color of this area and this area, they are different. This is a typical heart attack. But you realize that this whole muscle area is not affected. So the heart may not stop immediately. However, during a cardiac arrest, the heart suddenly stops. And one of the causes might come from this particular heart attack. However, to get a better understanding of cardiac arrests, when the heart stops suddenly, one needs to understand one fundamental thing, and that is the heart has an electrical system. So there's conduction of electricity within the heart, which regulates, this system regulates how the heart pumps. That is the rate, whether it should go slow or should go fast. It also conducts the rhythm, whether the heart should beat loop, dup, loop, dup, loop, dup, or loop, dup, 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 dup. So this electrical system makes sure that...
No, but sir, you realize that when you are in switched moods, maybe you are anxious, a bit faster, but you are calm, you know.
There are physiological aspects of, even when you are training, your heart will beat fast. These are physiological status. But when this system, electrical system is affected, then you have situation where suddenly the heart can go into overdrive, or will have what we call heart block, which slowly goes, and this can go into an overdrive again, and suddenly cause the heart to stop, hence depriving every vital organ of the necessary blood for survival.
What causes it? What causes it?
As I mentioned earlier, one of the, in 80% of the causes of sudden cardiac death is caused by what I just mentioned to you, the coronary artery disease. Disease of these vessels I showed you that supply blood to the heart. People, as a result of lifestyles, stress, apart from this coronary artery disease, high level of stress. When you are overstressed, a substance called adrenaline is released. That can send your heart into an overdrive. That can let your heart go into overdrive and can cause sudden death. Apart from this coronary artery disease I mentioned to you, the disease of the vessel of the heart.
Is that a type of it? That is a coronary arteries then? Is there a type of, cardiac arrest?
Cardiac arrest is cardiac arrest. It's one cardiac arrest. You arrest, your heart stops beating, we need to move in. If emergency attention is not given immediately within the minutes of the arrest, sudden death occurs. So the causes we've mentioned, the coronary artery disease, that happens when these vessels of the heart are blocked, those I showed you, and cause heart attack. That is about 80% of this
the heart is beating faster. What does this mean?
Now, that is, the heart normally must beat minimum of 60 beats per minute and maximum of 90 beats per minute. Okay? So if it happens that it's going more than that, there is a problem. But it doesn't mean that that fast heartbeat can necessarily give you a cardiac arrest. You could be exercising, your heart can go into 120 while doing at home. We're trying to stress people up to see whether they can withstand stress, to see whether the heart will comport well during stress. The heart can go up, okay, and then can go down. So it doesn't mean that you are going to cardiac arrest. But if there's an underlying cardiac disease, like this arteries I mentioned to you, or the heart is dilated for some reason, either by viral infection, your heart becomes dilated, we call them cardiomyopathies, or the heart is thickened as a result of severe hypertension, or you already have an underlying condition, like people are born in the family, it runs right through the family that you have certain abnormal heart rhythm. We call it long QT.
So what? It's like boom, boom, boom. So when it's that's,
Yeah, it's beating very fast. We call it tachycardia. It's faster. If instead of what you just made mention of, it does dub, 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 dub.
Yeah.
So it's slower than 60. That is brady, it's slow. There is a cause. If you don't check why the heart is slow, the heart might be in trouble of cardiac arrest. If you don't check why the heart is faster than 90, there are other causes. If we don't look at it from all the investigative point of view, ECG, chest X-ray, echocardiography, monitoring the heart during 24 hours by means of a device we have at the National Cardiothoracic Center. If you don't do all these checks to understand why the fellow heart is abnormal beat, he might be the risk of having sudden cardiac arrest and sudden death.
Yeah. Now, so how will I see? People say, oh, maybe this person is big, Ebola people, or, extremely tall. How would you know? What are the symptoms of it, of cardiac arrest?
Now, if somebody usually cardiac arrest can come with sudden fainting or loss of consciousness. If somebody, one of the symptoms of the cardiac arrest is loss of consciousness. You just lose consciousness. Now, other people might have other, symptoms like beginning with a chest pain, beginning with sensation of nausea, sensation of maybe vomiting, or some kind of dizziness, dizzy spells.
But that happens to all of us, also,
Yeah, but
sometimes.
if in a situation where you have a severely hypertensive, somebody with an underlying cardiac problem, like the coronary artery disease I mentioned to you, like the abnormal heart rhythm that runs through the families. Some people, some families have this sudden deaths that happens, among young people with a specific abnormal heart rhythm syndrome that is already there, long QT. Such families need to be investigated to establish so that they don't die suddenly. So these are the quantum as far as the symptoms and signs of. But invariably, most of them, they just stop, the heart just stops. And you need to move on quickly to defibrillate it. There's a kind of machine, device called defibrillator. If it's around and the fellow suddenly collapses, you can send some shocks to the heart, and then the heart will suddenly wake up. But if it's not timely and the defibrillator is not there, then the fellow might even be dead for a long time before we even get there. By the time you get there, it's already gone. And that is why now many public places, there's this automated external defibrillators that are available that can be used by even an untrained hand. When it happens, we make sure that the fellow baby is not even just fainted as a result of not eating well, or maybe some kind of problems, sudden other psychological issues that made him to just faint, not cardiac arrest necessarily. But these new machines that are over the counter from 2008 in the States also, they are able to differentiate between somebody who has fainted and somebody who really has cardiac arrest. So that, quickly, shocks are sent and the heart comes back alive. So without this immediate, response, within minutes, we are likely to lose, the patient.
But people are also saying that if it depends on your size. The lay people, we are saying maybe if you're small like my size, it won't affect you, or you won't have that arrest. Now, doesn't matter the size and the age.
The age, it increases with age. Risk increases with age, with lifestyle. Okay, your size probably will not be very, will not matter. Well, we have people who are smaller, but they have high risk factors, like high level of cholesterol, high sugar, stress levels are beyond control. Let me tell you something. There are people in this country who don't sleep more than 4 hours, and that is crazy. There's direct link between hypertension and the lack of sleep and heart diseases. Research papers are published and indicate the statistics. So even if you are smallish and then you don't have good sleep, you don't have good lifestyle, you drink a lot, you smoke a lot, you take salty diets, you don't exercise, you don't take fruits and vegetables, you eat late. My sister, we are all at risk. And I think it's high time we just rules to make sure that some of these lifestyles
So what do medical people look out for? We just look at, as I said, this person, is obolo or is this and that. So what do medical people look out for?
Obolo or obesity is a factor. It's a good risk, but it doesn't also exclude somebody who is not obolo. It can, and one good thing is, sudden cardiac death can happen to an apparently normal individual. Sudden cardiac arrest can happen to an apparently normal individual who has not been diagnosed of any cardiac disease. Probably he didn't know, and probably the family, there's this abnormal heart rhythm runs through the family, and he has no.
What if the other way around? There's nothing abnormal, everything is normal. What if that?
When the heart can go into overdrive because the stress, I mentioned to you the stress levels, chemical is released, it sends the heart into overdrive, and it can suddenly collapse. And sometimes it was after that they will realize, after ECG, maybe you've come out of the cardiac arrest. People have come out of cardiac arrest and they're taken to the ICU in our center and intubated, and remedies are found. But sometimes after that, because that person you see is, oh, this is normal, it's okay. Suddenly, then it is afterwards that you do some investigation, you realize that, oh, some chemicals within the blood are not right. Like potassium is a chemical in the blood, or magnesium. Deficient in these chemicals in the system as a result. For example, you can lose potassium as a result of excessive vomiting. An example. And if you lose it so much and it goes down so low, you can have a cardiac arrest. Because then the heart becomes chaotic and it goes into overdrive. And then that will be sudden death coming.
So how fatal is it, cardiac arrest? How is it really fatal?
As I mentioned to you, if every minute loss is we turn towards death. So the main thing is try to send shocks to this heart to get it out. Else fatality, I mean, it's the fellow dies suddenly. Now, so it should not be something that we should take for granted, and we should really, if somebody collapses and then suddenly we should get him to the nearest center to be given attention. As he might be having an arrest, and then, I mean, it's really fatality is quite high if immediate cardio, defibrillation or shocks to the heart are not given. The normal one was probably to do CPR. I mean, if you, that's, defibrillator device is not available immediately, do a CPR, and then try to give some kind of mouth-to-mouth, and then that is what the layman can do immediately without the. But if all these public institutions that we have can have this, automated external defibrillators at the workplaces, I mean, those especially that can detect whether what you are having is an arrhythmia or is an abnormal heartbeat that can send you to your death. Those equipment, as soon as it senses it, when you put it there, it will sense it, and then it will give. If it's not a cardiac arrest, it won't send the shock. So it might be some kind of fainting. The fellow may be low sugar level, he didn't have breakfast the whole day, then he collapses. That is different.
That's normal.
That is normal. Well, it's not normal because there's no sugar. Now, let's also forget very well that somebody collapses. There are other causes of collapse and sudden death. Maybe die while sleeping or die while doing some. And we have the famous one we call is a pulmonary embolism. Blood clot thrown into the lungs. Someone can die of it. And once you and I were not probably around at the time of death, you might think that, oh, it will go around, oh, it's cardiac arrest or something. But sometimes it's an embolus or clot thrown into the lungs, deprive you of oxygen, of air within the lungs, and then you can die suddenly without even any, information. Now, the other issue is people can have massive strokes, and they will not even survive it. Stroke can suddenly, those you see are those who come with weakness on the right side. Okay, he had stroke, one side is weak, or all the limbs are. But some stroke, people don't come out of them. They are so massive. And there's a direct link because the same brain, there are certain, these nerves, this electrical activity I spoke to you about, is the information comes from the brain. Most of the origin of some of these nerves that control the way the heart beat rhythmically, and then with a normal rate, they all have their centers in the brain. So while the brain stops, they will also follow. So sometimes, I mean, people can have this sudden death, not necessarily from the cardiac arrest, but because, I mean, they have a massive strokes that also leads to, the cause of it might not be just from the heart, but it also comes from the brain.
Now, let's look at certain lifestyles, you know, what we should and shouldn't do. What do you think we should do and shouldn't?
I think we should all regularly check ourselves and blood pressure.
No, but talking of checking ourselves, you go to the hospital, you tell them you're going to, they just take your iron, they take potassium, you know, blood samples, that's it. And then they say, oh, you are fine. But I'm sure there is something in it. So
as far as cardiovascular workup is concerned, as the heart and other things, there are extra tests that you will require, especially if you have...
No, but you wouldn't know what's wrong with you. So you tell them you're coming to examine yourself, and then you go through the iron, the usual thing.
Yeah, I don't think it's good to do a proper medical exams without checking your blood sugar, your cholesterol, your kidney function test, your what do you call it, cholesterol, sugar, blood pressure, and the stuff.
So what should you say? Like, I'm going to the hospital, I'm going for a checkup. What can I tell the doctor?
Yeah, tell them, look, I want a comprehensive medical checkup. I mean, that would bring into bear all this. And let me tell you something, in our setting, as soon as we come for a medical checkup, even if we go beyond cardiology, we go beyond cardiovascular diseases, and look at other, if somebody comes, he's 40, and he's doing a medical checkup, I wouldn't say because he's coming to me for the heart, I won't look for the kidneys, how they are functioning. I won't look at his prostate to see whether his prostates are good. I won't look at the eyes, because sometimes these diseases of the heart, they manifest themselves in other ways. And you have to look at it comprehensively because of these factors abound. Somebody who has smoked for maybe 10 packed years or so, you need to look at, apart from the coronary artery disease that we're talking about, he could also might be dealing with a lung cancer, for all you know. Somebody who has been alcoholic for so many years, you might be dealing with a liver disease. So you do the liver function test, you do the kidney function test, you do his ECG, which is basic to detect whether there's a risk of sudden cardiac death or sudden cardiac arrest. And ECG, coming to my field, is quite crucial. That tells you the rhythm and the rate of the heart. If the heart is slow or is fast, or there's certain waves within the heart electrically are not functioning well. It raises, and sometimes you look at the fellow, you see that there's evidence that he's hypertensive on the ECG, not just taking the blood pressure, just on the ECG. He hasn't taken the blood pressure yet. He comes to you and says,
the pressure will determine something
It will determine something to you. But when there's an end organ damage, if the heart begins to feel the pressure because the fellow hasn't been diagnosed earlier, within the ECG, it can tell you, this patient might have a blood pressure because the heart is beginning to feel it. Some of the patients we have, you ask them, tell them, no, or I don't have any blood pressure. And then you further investigate, and you realize that you check the blood pressure, it's in the skies, which has already started affecting their heart, but the patient doesn't know. And because it's a silent killer, there wouldn't be any symptom. Okay, so that is when you realize that this person is. I remember a 32-year-old patient who never knew he was hypertensive, came to me, and we started doing the investigations. The heart is already affected, the kidneys are already affected, and it's already 32. And you ask him, he said, no, I've never been told I have hypertension. The pressures were in 200 plus, and he never knew. He just came because he was feeling unwell, and somebody said, look, go and see the doctor. So we have 6 scenarios. So apart from this ECG, we have what we call the echocardiography. Echocardiography looks at the heart as it is, looks at the function, the heart pumping live. It's some kind of waves or echoes that reconstructs the heart, and you see it. You analyze the heart, you see whether it is thick, big, or normal. Whether it's beating fast or it's beating slow. This time, you are not seeing it on paper, but you are seeing it on a video. It's working live. And you look at the valves to see whether these valves are functioning well. Some valve abnormalities. Valves are the windows that open and close to allow the blood to flow. And this is an example of some of the, this is an example of the valves, okay? These are the examples of, this is the big, the pulmonary valve, this is the aortic valve. These valves, when they are malfunctioning, they can also trigger this situation of, what do you call it, sudden cardiac death and among other things. So the echo will give you that idea, will give you the how the heart is functioning.
No, but upon seeing me now, looking at me now, can you determine, I could see your heart is beating faster because you look at me from this side and you see, you'll be able to
some people, when they have a valve disease, you could see it from there. You could have an idea that, look, probably it might be a valve disease is showing because you have this, the neck vein or some of them, they are pumping up. They are not, you could see the signs abnormally that, no, this is not normal. There might be a valve. But you need to listen with our stethoscope. You need to listen to the heart to see whether the normal flow is what you are listening, or there is what we call a murmur. A murmur is some kind of rumbling, which is off the normal flow of blood across the valves. So once you hear that, say, there must be some kind of abnormality with the valve. Echocardiography, what we've just been talking about, after you listen, it will tell you which of, you might suspect that it's one or the other valve, but the echocardiography can reveal to tell you that, look, you are dealing with this kind of abnormality, correct it early, or the patient is at risk.
So it can be, how do we maintain it then? Let's look at some solving solutions to all
there are
this.
so many. If it's an abnormal heart rhythm that you have as a result of a certain underlying cardiac condition, we have medications, and that would slow the heart a little bit for you. But the risk of sudden cardiac arrest, once you have it and you've come out of it, is what we call a device that we call ICD, implantable cardioverter defibrillator, ICD. That is put. This device is different from pacemaker. It's a type of pacemaker, but it's able to tell you, to detect an abnormal rhythm and send a shock immediately. If it detects that your heart is going to an overdrive that can lead to cardiac arrest, it sends a shock to just abate it so that it doesn't proceed for you to have a cardiac arrest. So many people that we think they are at risk of sudden cardiac arrest, it's recommended for them to have it under the skin here with a wire that leads into the heart in anticipation of an chaotic rhythm that will send you to cardiac arrest and then stop it.
Okay.
So ICD, I mean, is what you have other medications like what we call the beta blockers that also are given to attenuate.
Yeah, but we've had some messages on Facebook and WhatsApp giving us some tips on first aid for cardiac arrest, like taking deep breaths and coughing and all that. But are these steps credible? I've been talking to Dr. Abdul Sami Tanko, head of cardiology at the National Cardiothoracic Center in Kolebu. Thank you very much for coming. All right, so we will take a break here and I'll be right back. Stay on.